And I'm going to leave some time for Q&A at the end because that's probably my favorite part is talking to you guys. In my business, I sit down one-on-one with people, and that's really what drives my passion is doing that. And if you know me, you know that I like creating change in people. I like to see transformative change in people's health. So this is a product that I'm really excited about. And I want to talk about the science of CBD. How many of you are familiar with CBD? I mean, if you're from Colorado, you really are familiar with it. They've got it everywhere here. I became excited about CBD a few years ago, but in Kansas, my home state, we weren't allowed to use, or you couldn't officially sell it until just a year ago. And so we're going to talk a little bit about some of the regulatory issues around CBD, but I want to talk about the science of CBD, and then we'll touch on the products that Bonvera has. Okay, so everything you need to know about CBD. Probably not everything, but a lot. All right, so here's the history of cannabis. So cannabis, starting around 2900 BC, so long time ago. This plant's been with humans for a very long time. We know that there's a long history of this being used medicinally, okay? And there's not a lot of talk about it being used as a hallucinogen. So really the first use of this probably was a medicinal use. And it's talked about in the Chinese literature as helping relax muscles. They primarily used the seeds, the Chinese did, and so they would have a way of extracting the oil from the seeds, probably pressure. I don't think they had steam separation back then. And while it's been used for a really long time medicinally, and in states like Colorado, a lot of the practitioners here have been using it for over a decade, we still don't know a lot about how it works. And this is a common theme, actually, with natural products. One of the things I've followed for a long time is the story of turmeric. And I don't know if you guys are familiar, but turmeric is a root. It's very common in India. It's a very deep orange root. If you've ever cooked with it, it gets on everything. And people in India, when they do autopsies, they actually have an orange tint to their brain. It actually stains the tissue, but it's a very, very powerful anti-inflammatory. So several pharmaceutical companies have tried to isolate the compounds in the turmeric root and tried to make a pharmaceutical-grade anti-inflammatory, and it doesn't work. And so we've seen this with several natural products. When you try to make a synthetic blend of it, we realize that we really can't improve on what God has put into nature. And so this is one thing I'm really excited about with this product. Okay, so that's kind of the history of cannabis. But again, what I'd really like to see is more trials. You know, as I said, I'm an FDA clinical investigator. We do a lot of clinical trials in my clinic. And although I don't use a lot of those pharmaceutical drugs, or I try not to in my practice, I do like being in the research world because it keeps me in touch with the people who are doing the basic science. And ultimately, my goal is to be able to do more studies on some of these natural products. And so we had the pleasure in our clinic last year. We were involved in a postpartum depression trial where we used allopregnenolone, which pregnenolone is a natural hormone that women make, and we were able to use that to treat postpartum depression. It was amazing. We had the 85% response rate in women, which was really phenomenal. So I want to see more trials like that, which CBD definitely needs. So what does CBD stand for? It stands for cannabidiol oil, and this is extracted from flowers and buds and seeds of marijuana or hemp plants. Now that's an important distinction. So this was discovered in 1940s as one of 113 compounds. So again, a lot of the compounds that are in the hemp and the marijuana plant are polyphenolic. And that's really just a term to mean that there's a lot of things coming together to be synergistic. And synergism is one way to make these products work even better. So when derived from the hemp plant, so when I talk to patients about CBD, the way I simplify it is I say, we're using the rope, not the dope, right? Okay, so the rope is the hemp plant. It's a fantastic plant. In Kansas now, the farmers can legally grow it. It's a good cash crop. The dope part is what has the THC in it. THC is what you're going to find here around Colorado. I mean, it's been legalized here recreationally for, 4 years maybe? So this doesn't have, when you derive it from the hemp plant, it does not have the psychoactive component of marijuana, which is THC. And CBD is known to have anti-inflammatory properties. It has some vitamins, the fat-soluble ones in particular, A, C, and D. So hemp versus marijuana. Again, cannabis sativa is the family that these plants exist in, and then they divide into the two. So we have marijuana, which I don't actually recommend using. I don't believe that there's really a lot of medicinal uses for marijuana outside of cancer pain, end-of-life issues. I think there's some value in there. There may be other issues for using medicinal marijuana, but I think most of the things that people attribute to medical marijuana are probably really from the CBD that's in that plant. And so it's really nice that we can get just the pure CBD. We don't have to worry about any of the drug component. And I think that's really important when you're talking to people who are going to be involved in your business and you're talking to them about carrying this product. They need to know that this isn't a dope product. And this is one thing that I said when we brought this product online. I said, I have really strict standards. We need to see a certificate of analysis. And for a lot of my patients who hold a CDL, commercial driver's license, they get tested regularly. And so they have to know that whatever they're taking doesn't have any THC in it. And that you have that with this product. So let's talk a little bit about the active CBD components. So terpenes, these are essential oils, part of that polyphenolic compound that is in there. You can find these in a lot of different products. In fact, terpenes are very common in the essential oils, even the other essential oil products that you guys carry. The terpenes, that's where you get the smell of a lot of things. So when you smell like lemongrass and things like that, that's the volatile component. It's aerosolized really easily. And so those terpenes are what gives the CBD oil its smell. Terpenes can modulate the effect. So remember I talked about synergism that happens. And so one of the challenges with this product is we have to have it as a CBD isolate, so there's no THC in it. So it has some other flavonoids that are added back in, other terpenes, other essential oils to help kind of really enhance the effect of the CBD. And so we'll go through some of those ingredients here in a few minutes. So this is the difference. So full spectrum CBD, I do carry one in my practice that has the THC in it, and I have to tell every single person that takes this, if you take this on a daily basis, it could turn a drug test positive. So there's a lot of people that can't have that product because of their job, because maybe their employer is going to be testing them regularly, or they're just really nervous about it. So that's a really niche product, whereas this one is not going to flag. It's 100% CBD, does not have any THC in it. So that's one nice thing about having the isolates versus the full spectrum. So the endocannabinoid system, why are we even using these things? And I think this is what was really remarkable about what I learned about a few years ago, is that our brain, inside of our brain, we have an endocannabinoid system. So remember when I said that these plants have been around humans for a very long time? Our brains have a similar system that these plants have. And that's why I love plant-based medicine. I love natural medicine, because it just works well with the way the body's designed. And I'm a firm believer in design and not just accidental evolution. So the endocannabinoid system we have inside our body, it receives and can translate signals from these exogenous cannabinoids. Helps to regulate functions such as sleep, our immune system, and one of the big ones I use it for is response to pain. Now, what we think, and again, a lot of the statements I'm making are, these are postulates. We have small studies. We have scientists who are fairly certain, but yet we really need larger trials to be able to do this, which is becoming easier now that states around us are relaxing some of their regulations. But it's postulated that these exogenous CBDs that you take by mouth or that you apply topically are interacting with our own endocannabinoid system and having their powerful effect there. So what are some of the benefits? And I would say these are the things that I use it for in my clinic. So reducing pain, reducing anxiety and depression. It's interesting, in the state of Colorado, well, first of all, do you know who the largest lobbying force is against the legalization of marijuana? Wow, you guys are right on it. Yeah, absolutely. They spend an amazing amount of money trying to block the spread of this particular product. And there's a very powerful reason why. In this state alone, in the time that it's been made legal, there's been a 30% reduction in pain medication, opiates, and antidepressants, okay? So that's a really powerful reduction. And so they see this as a threat to their economy, really. Reducing joint inflammation, muscle spasms. It can improve skin disorders. I have a few patients who are using it topically for psoriasis, which is an autoimmune condition. Very good for headaches. and relieving nausea in some people. So again, for patients who are going through cancer therapy, they're taking chemotherapy, this is a great adjunctive that they can safely use. So the regulatory climate, so we've touched on this a little bit. The FDA did clear CBD on a federal level for all 50 states. It has to be manufactured from the hemp plant, so rope, not dope. And that really they go by 0.3 THC. So you'll see a lot of the full spectrum ones are going to get their spectrum down so that it can just slide right under that 0.3%. But again, this one doesn't have any, it's 0. So DEA removed the hemp-derived products from controlled substance list in 2018. Did you guys know the history behind hemp and how it became illegal to grow? It was the Rockefeller family because a lot of paper was being made from hemp. And the Rockefellers didn't own hemp production, they owned trees. And so Rockefeller said, well, I'll just line the pockets of politicians and we'll make this illegal. And that's where the wacky weed and the loco weed came from, and it really got a bad name. So it's taken a long time to kind of pull the FDA back. I mean, this was a Schedule 1 substance, which other Schedule 1 substances are heroin. I mean, it did terrible drugs. So it's a misguided attempt, and I think we're finally starting to see the FDA relax and understand that there are some benefits here. So the FDA still oversees the hemp production, so that it's a pretty tight regulatory industry from what I understand. And there is in Oklahoma, it's being used in kids to treat drug-resistant epilepsy. So that's where probably we have the biggest data is on epileptic trials. So this brings us to the product that Bonvera has. And the reason I like to separate the science from the product is I want to be careful to make label claims on anything where I don't have an FDA clinical trial to back that up. So when I talk about CBD, and now I'm transitioning to what this is, I want to make it clear that we're not saying that Vive treats all those conditions. So that's kind of my standard disclaimer. So with the two products that we have, and I've tried both of these, and I'll say the one thing about the CBD oils that I've tried is that they have a really strong, well, does anybody like sucking on dandelions? Has anybody done that before? Yeah. I went to a really nice restaurant one and they served dandelion salad and I was like, oh, this will be interesting. Nope, not interesting. It's really a very bitter taste. And so a lot of the full spectrum oils have a really pungent taste, and so it's really, really hard to take. This one is mixed with cinnamon and it tastes amazing. You're not gonna smell any of that kind of skunky, weedy taste. So I think they've done a really good job of manufacturing on this one. And then the rollerball is really slick. This is just like a little pen rollerball device. So if you have muscle spasm or if you've got a knee that's bothering you, it's got some other essential oils, camphor and menthol and some other things in that really help drive the CBD transdermally and affect those local pain receptors. So both of these products, I think, are they available now? They are available now. So yeah. So again, I think the really important thing to drive home when you're talking to people about these products is this one's certified to be THC free. Not the minimum amount of THC, but no THC. So talking about some of those essential oils, when you're using CBD oil and the isolates, whether it's full spectrum or an isolate, you need to have a carrier oil. And what I don't like about a lot of the other products that are out there that you're going to see in the gas station is you have no idea where those carrier oils are coming from. And so these are all natural, non-GMO carrier oils. It's not rapeseed, it's not canola oil, it's not all that junk that we see out in the market. So these are really high quality oils that you can consume, okay? Essential oils, again, they're complementary. Each oil is carefully selected. I think they did a really good job of blending these essential oils in this particular product, not only for taste, but just for improvement of the effect of CBD. So, and at the center of this is the avocado oil. And avocado oil is one of my favorite oils. Have you guys ever cooked with avocado oil before? It's starting to be a little bit easier to find. I know our local Costco carries it. The great thing that I like about avocado oil over olive oil is that avocado oil has a much higher smoke point. So and I know you're not going to be cooking with this stuff, but just for your own knowledge, a higher smoke point means it's not going to break down as easy. So it's a really easy oil to cook with. You can add it. I mean, I've talked about adding avocado oil to our smoothies, the protein powders to boost the calorie intake if you're wanting to. So I was really excited to see that they're using avocado oil with this. And then there's a lot that's in, I'm not going to read through this whole list, but things like frankincense, blue chamomile, peppermint, camphor. This is in the roller ball. And so again, it's going to kind of help to release some of that heat help cool that joint down and really drive that CBD oil transdermally, which is where we want to see it done. I want to present a case study because I always like to talk about how I use these particular products in my clinic. So again, this is a generic use of CBD. This person was a 46-year-old male. He lives out in the country, and so if you live out in the country, you're going to be around ticks a lot. And he happened to be working on a treehouse for his kids, and he had a tick bite on his leg. But the tick was on briefly, got it off, no big deal, didn't have a big bullseye or thing that you worry about with Lyme disease. Patient didn't really think about it, but a few days later started developing fever, chills, just deep muscle aches, and then really bad pain in the left lower extremity. And so did some blood testing and found out that it was positive for Rocky Mountain spotted fever. This is a pretty dangerous disease. I remember as a medical student, we had a guy from Mexico that had a delayed diagnosis of RMSF, and he ended up losing all of his fingers. The tip of his nose died. It's a very, very aggressive disease if not caught in the first 2 weeks. So fortunately, this was caught within the first few days, started the patient on antibiotics, and improved in terms of the fever and the muscle pain. But what set in and what really bothered him the most was this very, very intense pain in the left lower extremity. And the way he described it was as if you had a sunburn, and every time you stood up, someone took a big plastic paddle and slapped the sunburn as hard as they could. So this is the kind of pain he was kind of having over and over again. So he did not tolerate being put on like opiates like Lortab and stuff like that. He gets sick when he takes those things. So I said, let's try the CBD. It had just become legal in the state of Kansas. And so we tried a CBD oil, and the response was profound. It was within 20 to 30 minutes, the pain was gone. He was able to carry out his day pretty normally. So this is the patient, by the way. So, yeah. That's my Saturday morning hair. And my beard that I grow usually during No Shave November, or my wife calls it No Kiss November. So I don't grow that beard very much anymore. So, but it really was. I mean, I was one of the first patients that I used this on, and I remember that pain was unbelievable. And so I'm a very big believer in CBD oil for relieving pain. So that's a first case study. So I thought you guys need to see me on a bad day. So case study number 2 is even more profound, and I feel bad that it wasn't me who came up with this idea, but it was the son who was actually advocating for his mother. So this is a patient of mine whose mother is in a nursing home. I take care of her as well. She's 98 years old, and she has really severe kyphosis. Kyphosis is when your back starts to bend over, and hers is so severe that she has lost about a foot of height. And when I talk to her, she has to turn to the side to look up at me. So she's in a lot of pain. When she came to me, like most patients do, they have a list that's a mile long of all the medications they're on. And so one thing I do, especially for my 98-year-olds that are in the nursing home, is I say, well, let's get you off your cholesterol medication. We're not worried about that anymore. So we started withdrawing medications, but the one thing that we couldn't withdraw from her was her opiates. And she was on really high doses of oxycodone, which if you've been following the news, oxycodone is the most addictive of all the opiates out there, produced by the Sackler family. So if you can slap a Sackler, slap a Sackler. They've really led us down this terrible pathway where we're all addicted to opioids. So she had a lot of depression, and I see a lot of patients have depression, and I'm very careful to ask, why are you depressed? And most people will tell me, well, I'm depressed because I don't feel good. I'm depressed because I hurt. I'm depressed because I can't sleep. That's secondary depression. That's not, you need Prozac depression. You need somebody to figure out what's going on. So her depression was clearly from pain. She had a very low quality of life. So again, she'd had a lot of opiates added to her. Her depression worsened. The nursing home reported that she really wasn't very active. She stayed in her room most of the day. So quality of life was pretty poor. So her son came to me and said, hey, I've been reading about CBD oil and it's good for pain. And I said, yeah, I agree, but your mom is on high doses of the strongest OxyContin we have. And I feel bad for saying that because I kind of tried to sway him away from trying this, but he said, well, let's do it. Let's try it. And I said, okay, I'm fine if you are. So we put her on CBD oil, and 2 months later, she was off all opiates. And I really wondered whether this was true. And so I went back and looked at her. The nice thing about someone in a nursing home is everything they're given is documented. And she has not had any opiates since being on CBD oil. Yeah, it's been fantastic, right? So her son was just in the clinic yesterday, and I asked him, I said, how's your mom doing? And she's like, she's doing great. And I said, still taking the CBD? He goes, loves it. She's more active. She comes around to the game room. She's interacting with the other guests that are there. So it's really pretty remarkable. So, question and answer.
Yes, sir. When treating pain, such as with that 98-year-old lady,
Uh-huh.
are you using the topical, the oral, or both?
So she's on an oral. Yeah, she's not getting topical. She would probably have to rub the topical all over her body. So, yeah. So she's on an oral, and I use the oral for my leg pain.
I
Yes,
was
sir.
talking to a lady that cuts my hair, and she likes what you do. She's likes a naturalist,
Yeah.
and she ordered some of the CBD oil, the topic or the kind you
The
take
roller ball.
orally,
Uh-huh.
the oral. you put it
Oh,
in
the
cup.
oral, the tincture. Yeah.
And she ordered it out of Canada from some top person up there and paid $130 for it. And she said
Yeah.
it gave her a sore throat. So
Yeah, so the carrier oil may have been, not a great carrier oil. Some of those, the other oils they put in are much hotter, and so they can actually burn. A lot of you guys who do essential oils know how important it is to put some of the hotter oils in with a carrier oil. So that's probably what happened. I don't think it was the CBD component that did that. We're going back over to this side now.
Okay.
All the way in the back.
My question is, what about with diabetics, and does it work, or just stuff on diabetic people?
Yeah, I wouldn't have any problem using it in a diabetic. Again, it depends. Diabetes is a broad disease that affects a lot of areas of metabolism. So, if that's someone who has diabetic, neuropathy, pain in their feet, that could help. Yeah.
I have DVTs and I'm on Xarelto.
Mm-hmm.
And I recently just read an article this morning that talked about any drug that is, it has to do with like the grapefruit and the way things are something about metabolized within the liver and stuff, that any prescription drug that says, do not use in conjunction with grapefruit should be used in caution with, using CBD oil. Do you have any knowledge or anything you can share in regards to that?
Yeah, there are certain drugs that are, and what happens is there's a system of enzymes in the liver called the P450 systems, and everybody, and some people react depending on their genetic SNP. SNP stands for single nucleotide polymorphism. So those all affect how drugs are metabolized, and things like grapeseed oil or grapefruit oil can upregulate that, so they metabolize it much too fast, and so it'll actually have a greater effect in some people. And some people have the opposite effect. Their normal dose won't work. And so it's much like when someone's on Coumadin, you have to be careful about how many green leafy vegetables they're eating, because the vitamin K can actually make the Coumadin less effective. So I don't know in terms of CBD oil whether that exists. So again, that's where I really want to see a lot more clinical trials. I'd love to see which SNPs are metabolizing CBD. But again, I think it depends on whether it's an isolate or it's full spectrum, whether those terpenes are in there, what's the carrier oil. So these are all good things to ask your doctor. And I always tell people, I'm not, this isn't me practicing medicine, this is me giving you some advice. The unfortunate thing is if you ask your doctor, they're probably just going to tell you don't take it. And I get that a lot. So, but that'd be my disclaimer. In case the FDA is listening, that's my, yeah.
Would you say using the two for my SLE lupus would help me to get off of some of my strong medication and help me with my joints and muscles?
If you're talking about getting off of pain medication, then I'd say it's absolutely worth a try.
Yeah. Okay.
Yeah, absolutely.
You mentioned a minute ago about children, so my question is it safe for children? What age and dosage-wise? Because it does say dosage on the bottle, but would you give the same dosage for a child, and how would you use it for a child?
Yeah. For children, again, I'd be much more comfortable using one that had no THC in it. The dosages that they use in some of the epileptic studies are very high doses. And so I always like starting with it's easy to add more to see if you need to get an effect. It's really hard to take it away once it's in them. So especially if a kid's having difficulty sleeping, I would just try a very small amount. But it depends what you're treating with kids. And with kids, I'm very much not a pill for problem or even nutraceutical for problem. I like to really investigate and see what's at the root cause of what's going on with kids.
Dr. Davis?
Yes,
Obviously, we have both of them, the roller and the tincture.
right.
You said you used the oral for your leg. When would you suggest using one or the other? And then also, if you use the tincture, is it under your tongue, on your tongue, in your ear?
Yeah. It's anywhere there's mucosa, you could probably put it. So under the tongue will allow it to go into the bloodstream a little bit faster, the longer you can hold it there. I have a really hard time holding things under my tongue. If you swallowed it all, it'd still have an effect, but some of that's going to go through the liver, and the liver's job is always to disassemble. So the liver, hold it as long as possible, yeah. And then when to use topical versus the oil. I think the two can be used together even. The reason I didn't use a topical on my leg is it's just a large surface area. Yeah, so if you had a small area, then I think topical would be perfect for that.
I have information that CBD it will totally reverse or improve over 400 health issues that affect the human body. Is that true?
Well, again, I'd be very careful making that statement without the clinical trials to back it up. But I will say anecdotally, I have a lot of patients who have failed on many medications who have found benefit from using CBD. And so the more I hear of these stories, I have to be open to that possibility. I just would love to see more clinical trials being done so that we can really have more information and understand the nuances of how to use CBD. But I like it because it's safe. A lot of times when I talk to patients about therapy, when I talk to patients about therapies that we don't have a lot of information about, I always talk about risk versus benefits. And I try to bring up the picture of if you saw a $100 bill in front of a moving train, would you grab it? Probably not. Now, if there's a $10 bill in front of a toddler riding a tricycle, would you try to pick that up? Yeah, why not? What's the worst that's gonna happen? So that's kind of the thinking that I use with these CBD oils is like, hey, you're trying to pick up a $10 bill in front of a toddler. Go for it. What's the harm?
So I've done some research. I was talking to you backstage, and so I think the community being educated, and you can correct me on some of this stuff since you're more of an expert than I am. I think it would be helpful for them to understand like 300 milligrams versus 600 versus 1,000 milligrams. And then also understanding every time they do a dropper that they're probably, and you can correct me, probably only getting 33 milligrams of that actual 1,000 that's in there. You have to divide it and do the math on that.
Yeah, I believe with this product there's going to be a dosing guide that explains all of that. But yeah, I would definitely look at the dosing guide. Every product is a little bit different. Sometimes it's hard to interpret those labels.
And then the last thing is I've heard that you can do up to 100 milligrams a day of CBD, and then anything over that can actually start to give you a headache. So that can kind of figure out how to dose.
Yeah, so
is that true?
and this is an important thing to think about anytime you're using a natural product of anything is a side effect of toxicity. Even mild toxicity is usually going to be nausea, vomiting, diarrhea, headache. So if you have any of those symptoms, you got to think about, okay, what did I take? And if patients want to know if something's causing a side effect, what I tell them to do is stop taking it, wait till the side effect goes away, try taking it again. If you get the side effect again, then you know that that's reasonably sure that that was the thing that was causing it. So kind of stuck here in the middle.
My question was, I have a friend with an autistic, right over here. I have a friend with an autistic son, and
Wave your hand because I'm trying to figure out where you are. Okay, all right, sorry.
And she was wanting to know if you've seen any benefits in using it with children with autism.
Yeah, so in our, one of the fellowships that I carry is the Medical Academy of Pediatric Special Needs, and we have several of us working around the country on what I call the problem of autism. And it's a devastating diagnosis, and I think there's a lot of people out there that are trying to tell us as physicians that the reason we're seeing more cases is just because we're getting better at recognizing it. And I said, I really don't think doctors 50 years ago misrecognized a kid going ee and hitting his head, right? So I really do think there's something environmental that's going on. So I don't think that CBD is going to be a panacea, but a lot of these kids have a real dysfunction with their gut, and they have a lot of pain. And if they're nonverbal especially, it's very difficult for them to express where that pain's coming from. Very common thing you'll see with kids when they're stimming is what they're trying to do is they're trying to distract their brain from pain that they're feeling. And so that's a great way where CBD can just sort of calm that sensory input they're getting. And so I've seen kids have great results on it. So a lot of the practitioners that I work with that are in the Medical Academy of Pediatric Special Needs, we rely on CBD as one of our therapies. Yeah?
Okay, so my grandmother has no cartilage in her knees, and she said that it's very hard for her to walk around and it's very painful. So which one of the CBD oils, or if both of them, would be the best bet to take, and how much? And
Yeah. That's a good question. No cartilage is tough because those nerve endings in the knee are going to be pretty frayed, and then if she's overweight, that's going to be the biggest factor for pain. If you're 1 pound overweight, it's 4 extra pounds on your knee when you're standing, 6 extra pounds when you're walking, and I think 12 extra pounds when you're going up and down stairs. So that's just for every 1 pound overweight you are. So the first way I address major joint pain in the load-bearing areas is by weight loss. But I would say really it just comes down to experimentation. She may get by with a topical. There may be some days where she wants to do the tincture. She might need to do both. So it would depend. Everybody's going to be a little bit different. I'd probably try the tincture first. Yeah.
Over here.
Yep.
So real quick, back on the autism, my brother has autism, and my mom has tried the CBD with him. It helped tremendously. I mean, we went to the store, he didn't stim at all, and normally he does. I mean, just even the slightest little bit. He wasn't stimming. He slept great that night.
That's great.
It was amazing.
Yeah. Yeah, that's awesome. You know, when I hear stories like that, I always, whenever something like that works, I always want to know, okay, but why is it working? You know, for him, was it treating the pain that maybe needs to be further investigated? Maybe it was helping to improve sleep, which is going to help improve brain function. So that's a phenomenal story. Thank you for sharing that. Yes.
Right here. In regards to taking it orally for chronic pain, maybe rheumatoid arthritis or something, what would be a reasonable expectation to feel the relief, like in a time frame?
Yeah, well, I mean, like I said, with this patient that was in the nursing home on the highest, most powerful opiates that we make, within 2 months, she was off all of them. So, and, you know, the downside of being a doctor is I prescribe something and then I frequently don't see people for 2 or 3 months. So when they come back, I don't always get the report that, hey, this helped at hour 18 or day 18. But pretty quickly, I think people will see, certainly within the first 2 months, you know, if it's not working at that point after 3 months, I tell people we probably need to try something different.
Dr. Jeff, I have a brother that has primary progressive MS, and he's been in a wheelchair for 7 years. Would the CBD oil help him, and what else would you recommend?
Oh, what else would I mean, MS is another autoimmune disease, so again, in our clinic, we take a pretty comprehensive approach to that. With MS, actually hyperbaric oxygen is being used quite a bit, so if he has the ability to get hyperbaric, that can be beneficial. I think where CBD can be helpful is with, again, if there's pain involved, some areas of the brain are affected by those lesions, cause pain, difficulty sleeping. CBD is excellent for promoting sleep. You know, so that's probably where I would start.
Hi, Dr. Davis.
Hi.
I have a friend that was fighting cancer for about 20 years, and she had a bad night. She had some CBD. She took about 1,000 milligrams, and she took a lot of morphine. She was throwing up and can't pee from the morphine, and the CBD helped her to relieve her pain as well as she could pee. So
Yeah.
she was really excited about that.
Probably the effect that she was getting was that effect on the receptors in the muscles, so the muscle relaxation of the sphincter around the bladder. So that's great because that is a side effect of morphine that can be pretty bad. It can also cause the gallbladder's sphincter to spasm as well.
What about liver enzymes in CBD oil? Is that something that should be monitored when you're taking it?
Anybody that's on either a medication or any supplement regimen outside of just a multivitamin and fish oil, I check liver enzymes every year. And I've not seen any elevations, but I check.
My daughter suffers from Tourette's syndrome, so she takes like 25 pills at night, and I'd like her to get off her medicine. Her son and her other son has the same thing.
How long has she had Tourette's?
Since she was about 8, in the 8th grade.
Okay, and did it start very suddenly?
No, it progression. I thought it was her eyes fluttering, so we had our eyes checked. We went through all the rigmarole first.
Does
but
her Tourette's get worse if she has like a strep infection, strep throat?
I don't think so. She hasn't had that. But when stress happens, she goes into migraines. She goes into, but her son also has it, but he suffers from stomach migraines, which I'd never heard of.
Yeah, you can have a spasm of the vessels in the brain and also spasm around the splanchnic blood flow, which is around the gut. So yeah, you can have abdominal migraines, we call them. Yeah, I mean, the thing with CBD is it's going to affect a lot of different areas, you know, so again, pain control, help with muscle relaxation, so it may help with some of those spasms. I have had patients who have chronic migraines that find benefit from using it. So, you know, with a lot of these things, again, it's the dollar bill in front of the toddler. Go for it.
Dr. Jeff, thank you so much for everything you're doing here. It's really helpful.
You're welcome.
I have a Brazilian doctor friend who he's an addict doctor in Brazil. He specializes in addict rehabilitation.
Uh-huh.
And he's convinced that CBD will help him with his crack coke addicts and getting them off of that.
Right.
I guess the question is, will those receptor sites be bluffed into receiving the cannabinoids instead of the cocaine addiction?
Yeah, that's a great question. I don't think so because the endocannabinoid system, you know, it's an endogenous endocannabinoid system, and I believe it helps. I think there's a synergism that works with our own cannabinoid system. But again, I'm not an addiction specialist. All I know is that the data has been that people who are using some of these very addictive substances are coming off of them with relative ease. So that would be my suspicion. Yeah, it's good. That's really cool. Yeah.
To your left. A two-part question, one concerning physics and the other on CBD. I have a customer that has, if I can say this right, interstitial.
Interstitial cystitis?
Yes.
Okay.
And she's had it, she's chronic and she's pregnant.
Oof. Boy, got a baby sitting on a bladder. So interstitial cystitis is where the bladder is really irritated. You just feel like you have to pee all the time. And then being pregnant, I've heard, makes you feel like you have to pee all the time. So remind me again, what was the question?
Well, she's concerned about the vitamin C and the physics.
Yeah.
And so she's reluctant to use those while she's pregnant, and then anything while she's pregnant as far as CBDs or anything to relieve the pain.
Yeah, I do not know with pregnancy. I'm really careful when women are pregnant. I don't let them take anything outside of the prenatal vitamin, fish oil. The vitamin C can irritate interstitial cystitis because it is an ascorbic acid. So that's going to be something that, I mean, if she's experienced problem with vitamin C's in the past, that could do it. The magnesium may help because, again, there's a very strong muscle around the bladder that spasms. And so either one of the magnesium products could be beneficial for her.
So the question is, what does CBD have an effectiveness of like Parkinson's? Do you know of any at all?
Yeah, so Parkinson's is one. Most of my experience with Parkinson's is people using medical marijuana. But again, I think that the CBD and the medical marijuana is what's helping the most. And there's a fantastic YouTube video that I show a lot of patients who have Parkinson's, where there's a Parkinson's patient and he's just shaking all over, can barely put 3 words together. And his friend gives him a tincture, and I believe it was probably a THC CBD combo. And within 5 minutes, the guy was carrying on as if there was nothing wrong with him. And it was remarkable. Yeah. So, again, I don't have a big clinical trial to point to, but when I see these things, your jaw just drops. So, all right. Well, thank you guys so much. I appreciate it. So, thank you guys.